Hi, I'm Edie Hand, and welcome into Prescription for Healthy Lifestyles. We have a very special program for you today. It's about Alzheimer's. My good friend Dr. Daniel Potts has interviewed Dr. Jim Houston and Cathie Borrie. They were in Canada. And that was special to them, and it's special to me because my grandmother Flory gave this to me before she lost herself. Please join us as you watch this special program.
Prescription for Healthy Lifestyles is brought to you in part by the Edie Hand Foundation, www.ediehandfoundation.org. Enjoy the latest books from Edie Hand. A portion of sales benefit charities such as St. Jude Children's Research Hospital. Visit www.ediehandfoundation.org or your local or online bookstore. Pick up your copies today. A Pocket Guide for the Alzheimer's Caregiver by Dr. Daniel Potts and his wife Ellen helps you understand this disease and get the best care possible. Go to alzpocketguide.com or any online bookstore for your copy. You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
Welcome back to Prescription for Healthy Lifestyles. I'm Dr. Daniel Potts. A few months ago, we had a wonderful opportunity to go and interview Professor Jim Houston, who is a world-renowned theologian and friend of C.S. Lewis, about his experience with caregiving and about what he thinks it means to be a person living with Alzheimer's disease. Here's what Dr. Houston had to say.
I think the first thing that challenged me about it was, is this going to be the worst phase of our life or the best phase of our life? And I just felt prayerfully that it should be spiritually the most enriching phase of one's life. And I think I was able to enter into that because I had always had in the trajectory of my own thinking and my own life that primarily I was not having an identity as a professional, but I had an identity as being a person. And to be personal means that you are intrinsically relational. So that if you lose a function like the loss of memory or the loss of anything else in old age, that disability is not necessarily a spiritual liability, but rather it can be an asset for something that is more spiritual, even though it's less physical. And so that's how we entered into it. And so I said, my dear, this is going to be the best phase of our life.
In this interview, Professor Houston helps us get a handle on what it means to be a person, what is meant by personhood, and if personhood does persist despite the fact we may have Alzheimer's disease or another dementia. Here's what Dr. Houston has to say about this.
Well, that continuum of being primarily a person before I was a professional is something that I've now brought into our marriage and into our late family life. Because Rita is not just simply a housewife. She's my wife, uniquely so. And because she's my wife, we have a personal relationship with each other that has always been special. And we're devoted to each other. And so I told her that with her disability, this would be an opportunity for more expression of love rather than less. And so it has been. And so when she began to lose her memory, we talked about this quite openly. It's a great loss, my dear. It's like losing a foot or losing an arm. And it's unfortunate it's neither, but it's your mind that is being lost. But in spite of that, let me be memory to you. So can we share a memory? And then our grandchildren began to help because one of our grandchildren has produced a series of pictures of all the family and the children and the grandchildren and the great-grandchildren with their names, their photograph, and their date of their birth, of their birthdays. And so whenever Rita says, oh, who is Jonathan? I've forgotten who Jonathan is. Well, my dear, here's the album. And so there's a memory book of love that helps her to recapture what she's lost and to know that others are remembering even though she has lost it herself. And of course, because of our Christian faith, to know that the resurrection is the reality that God remembers us. The dying thief on the cross, he asked Jesus, he said, "Will you remember me when you come into your kingdom?" And so that's the affirmation that when we're dust, we're still eternally remembered. And so that is projected back into our present situation. That many times, my dear, I will have to act as your memory. But that's okay, because we can share that together. Now, in terms then of other elements of caring, there are things that we still have a sense of shame. Perhaps shame is a deep ingredient of our personhood and the dignity of being persons, that we have a sense of shame. So to protect the other person and not remind them of things that are negative is also part of the skill of caretaking. That we don't remember bad things. We're the monitor of good things, loving things that we can share together.
That is absolutely on target from everything that I've heard and read and discussed with other individuals about person-centered care and the way one should interact with those with dementia.
Yes.
In a very validating way. Another question. We are very interested in the ability and need for individuals with cognitive disabilities to express themselves. Because one of the things that we know that happens in dementia is that an isolation takes place because of this lack of ability to communicate. How do you see creativity as important for our sense of self-preservation and for the preserving of our personhood?
Yes. Well, I think, and you obviously know much more about this, Danny, than I do as a neuroscientist, but it does seem that in our basal memory, there are elements from childhood that need to be sometimes elicited in old age. And one of the things that Rita always grew up with was that her mother was the soul of hospitality. And during the war, many young officers were brought for a Sunday lunch or for the weekend rest from their military duties. And so she grew up to imitate her mother with hospitality. And so today, what is most significant for Rita is always to keep asking me each day, and who are we going to invite for a meal? Who's going to come next? Well, we're limited in how much we can do ourselves, so we are now booking a place to have dinner every week with some couple that we share together. And it's on these occasions of hospitality where Rita really lights up and expresses herself.
Stay with us after the break for more from Vancouver and Dr. Jim Houston on Prescription for Healthy Lifestyles. Prescription for Healthy Lifestyles is brought to you in part by the Cognitive Dynamics Foundation, bringing art to life.
A Pocket Guide for the Alzheimer's Caregiver by Dr. Daniel Potts and his wife Ellen helps you understand this disease and get the best care possible. Go to alzpocketguide.com or any online bookstore for your copy. Enjoy the latest books from Edie Hand, a portion of sales benefit charities such as St. Jude Children's Research Hospital. Visit www.ediehandfoundation.org or your local or online bookstore. Pick up your copies today. You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
Welcome back to Prescription for Healthy Lifestyles. I'm Dr. Daniel C. Potts. We're coming to you from Vancouver, where we're visiting Professor Jim Houston, who is discussing with us caregiving, Alzheimer's disease, and personhood. Dr. Houston now tells us how important it is for us to remember for our loved ones who have the disease. You talked about the importance of childhood memories and bringing those back out. One of the things that we are finding as we administer various arts therapies to individuals with dementia is that those childhood memories do find a way to come out through creativity, through music, art, dance, storytelling, and that sort of thing, and reminiscence. Mm-hmm. Tell us, Jim, how caregivers can take hope and encouragement from the ideas that you've discussed with us today about personhood, and so that they can be buoyed up in their journey with their loved one.
I think one of the great temptations for the caregiver is to do it from patronage, that they're superior and their situation comparably is therefore different from that with the one they're caring. And so when they lose the sense of reciprocity, they then have what you might call emotional burnout, because they're doing all the giving. But in all relationships, there's reciprocity, that you're kind to me and I'm kind to you, that I care for you and you can care for me. Now, a caregiver has the impression that they're doing it all in a one-way street. Well, I think the consequence of that will be exhaustion, emotional exhaustion. Mm-hmm. Also, of course, I think what we discover with caregiving is that it touches emotions that we've never been skilled in using. So some of us grow up to be impatient and we're always angry. Well, that's hopeless for a caregiver. And so one of the things that we discover about caregiving is it's a test of our own narrative at the end of our own life. How have we lived is how we will then respond as a caretaker. And so if I always live selfishly, I'll be stretched, screaming mad, because I have myself to care for, not you. We cry out, you see. And so again, if somebody has always been rather selfish and not generous, then again they're tested. So caregiving is a mark for sanctity at the end of life, for sainthood, not for the immature. And so if we remain ourselves immature, and tragically many of our old people's homes are filled with people who are immature, because the exaggeration of old age is that the vices and the weaknesses that we had when we were younger now become amplified and exaggerated in old age. And so old age is a judgment. It's a judgment for those who need to be cared for, but it's a judgment of those who are caring. And so it works both ways. And so it's essential, I think, for us to recognize, as I said, that you become an elder when you start as a child having empathy, and not simply remain a senior that is now on the shelf. And so I think, as I embrace this period of my life, this is not just a test of one's previous training, it's a fruition of what one was meant to be. And so I see that becoming older is for the mark of maturity, of fruitfulness, and not of decadence, not of deterioration. And of course, we're meant to be spiritual beings, not just material beings. So if we've lived a sensual life and have no real quality of being spiritual towards other people, then clearly that will mark us in our old age. So I thank Rita, I thank others that I'm in touch with who are old and having to care for, that they're bringing things out of me that are potentials for my own growth. And so it's not a burden, it's a privilege.
Stay with us for more from Vancouver on Prescription for Healthy Lifestyles.
Prescription for Healthy Lifestyles is brought to you in part by Children's of Alabama, 100 years caring for children.
Children's of Alabama has been taking care of kids across our state for over 100 years. The opening of the Benjamin Russell Hospital for Children allows even more patient care. It leads the country in technology and innovation, including 17 state-of-the-art operating rooms, an expanded imaging center, and the Bruno Pediatric Heart Center, just to name a few. Children provides the highest level of care in a loving, comforting environment. I hope that you or anyone in your family never needs to be a patient, but if they do, Children's is here for you.
Here's a prescription for a better life with Dr. Daniel Potts.
I'm Dr. Daniel C. Potts with Prescription for Healthy Lifestyles. And I want to share with you today some tips that we learned when we were caring for my dad, Lester, who had Alzheimer's disease. We learned from dealing with Dad's illness that Dad was still there. We just had to learn to approach him in a different way, to listen for his voice that was still inside. The essential elements of who my dad was were still present despite him having Alzheimer's disease. I'll call them pillars of personhood. We can build a relationship around these pillars that can be strengthening for both individuals. We as caregivers need to value the essential traits our loved one still has and learn to love those in the moment.
Prescription for Healthy Lifestyles is brought to you in part by Scott Crump Toyota Scion.
Can you imagine a world without children? A world where children don't play, or dream, or imagine.
At St. Jude Children's Research Hospital, we're working every day to find cures for diseases that strike down children, because we can't imagine a world without children. Can you?
Finding cures, saving children. St. Jude Children's Research Hospital. Call now or log on to stjude.org.
Prescription for Healthy Lifestyles wants to help you pave the way to a better life.
Welcome back to Prescription for Healthy Lifestyles. I'm Dr. Daniel Potts. We're coming to you today from Vancouver with a guest, Cathie Borrie, who is a Canadian author and caregiver. She wrote a story about her mother's poetic voice that came out in the midst of Alzheimer's disease. She learned to listen a different way. Now, Cathie, was your mom always poetic before the diagnosis?
She wasn't poetic at all. And, I was expecting this slow descent into nothingness, and in fact, the opposite happened, and it took me by complete surprise. I was just trying to think about the first time it happened, and I remember we were in this cafeteria in a mall, and it was a very depressing place. It was full of wheelchairs and walkers, and we used to go in all the time. I was feeling quite down about everything, really. And I wanted to ask her advice about something, and I wasn't sure if she still had the capacity to answer my questions in the way that she'd done so well before. But I thought, well, I've got nothing to lose, I might as well ask. So I said to her, Mom, what do you do if you love somebody but he doesn't love you? And without skipping a beat, she says, go find someone else. And it was so funny, but it was also very good advice. So I just kept going, and I wrote it down on a napkin. I still have the white coffee stained napkin in my files. And I think it was that moment where I thought, there's more going on here than I thought and that I was expecting, and that I'm doing her a disservice by having limiting expectations. And after that, I started to record our conversations, and she just continued to amaze me.
It's almost as if she began to paint in watercolors like my dad did, in a very free and expressive way. Was she at all, in other words, how did she express herself earlier on? Was she a very verbal person? Was she someone who was musical? Was she creative? What was her mode of expression earlier on?
She was very musical. She taught piano. She played piano. She probably could have been really quite well known, but she was stage shy and she didn't want to do it. But she was performing at age 6. Mm-hmm. Perfect pitch, beautiful singer. We used to sing together all the time. She had some other creative interests like gardening and things like that, but I'd say that the music was most important to her, and we used that all the way through her illness, playing songs or singing ad lib all the time. We used to have this little game where I would sing the first note and then she would try to guess what it was, and she'd guess what it was every single time. And so that carried us through in a big way. She was a quiet person, very self-effacing, and in terms of expression, she was in that generation of people that just didn't share their feelings, so she was very reserved. Mm-hmm. And that changed a little bit as well, but all for the good. She just said lots and lots of funny things. One of the things she loved greatly were birds, and we had bird feeders outside the balcony in her condominium, and it took up a lot of our attention. And one day she was looking, and she said, this is out of the book because I put her quotes together. Listen, a bird. I said, what are the birds saying? They're chirping. In a language? In their language. In an upside down language. So I'm not smart enough to understand what she meant, but she knew what she meant.
Of course she did.
You know, it's like reading poetry. You don't always get it, but the answers are there.
Right. Now, there are discussions in the book, and you talk about birds and natural things and ocean scenes. Talk about her love of nature expressed through the book.
She did. She lived by the sea, and she loved the ocean. She was a boater. She fished, which was quite unusual for a woman of her generation to get up in the morning and go out fishing alone, come back with salmon for dinner. But she loved the sea, and those sorts of things sustained both of us throughout her illness. We were lucky enough that she lived in a place where we had a view of the ocean, and we would spend hours and hours watching the tugs come in and the freighters. We had a marine radio, so we would listen to the pilots chatting to each other. And so we were able to tap into what had been important to her in her earlier life. And those sorts of things like the ocean and the sea and boats, you don't have to have a huge memory to know that you love those things. So they endure.
Tell me what you learned about yourself as you were caring for your mom and as you were hearing these things that she was saying.
I learned that I didn't have enough patience, and that I needed to be much more patient or I would miss all these beautiful words. And I think what happens is when you keep interrupting and correcting and interjecting and reorienting, you miss what the person is going to say. So I had to learn, and I'm still having to learn this, going from being quite an outgoing, active person to having to really sit back and keep my mouth closed and listen and ask questions. And we could do that all the way through. So I certainly learned that I had to do that better. I also learned that there was in me a poetic voice that I had not known. And that voice came out in the form of a lyrical memoir. And I had always wanted to write, but I didn't know if I really could or what I would write about. And that she gave me that opportunity to write about our experience together.
Thank you for joining us on Prescription for Healthy Lifestyles. It's brought to you in part by cognitivedynamics.org, and we'll see you next week.